Today is World Lupus Day, and Beaumont Health is raising awareness about this chronic autoimmune disease in which the body attacks its own healthy cells. Dr. Joseph Skender is here with us now, Chief of Rheumatology at Beaumont Hospital in Royal Oak. Good morning.
Hey, it's a pleasure to be here. Thanks for having me.
Well, and thanks for being here to explain to us what exactly is lupus. We want to know, and also what causes it.
Well, as you mentioned, lupus is a chronic autoimmune disease. The immune system is there to help prevent from getting infection, keep your body from getting cancer. It's kind of a surveillance system of the body. And lupus, the immune system kind of goes haywire. And instead of helping the body, it starts attacking the body with inflammatory reactions in different parts of the body.
Now, according to the Lupus Foundation of America, women account for more than 90% of lupus cases, and the CDC says Black and Latino women are more likely to have lupus. Why is that the case?
We're not sure. There's obviously a genetic component to that, a hormonal component for the females. You know, later in life, the men start catching up to the females after menopause age for females. But we do know it's 4 times more common to have women of color, you know, Black, Asian, Hispanics, they have lupus than Caucasians.
And what symptoms do patients usually report?
So lupus can affect any organ in the body, and so it's a wide range of manifestations. So some patients can have mild lupus, just affecting the skin and the joints. But then lupus can get more severe and affect major organs like the central nervous system, the heart, the lung, the kidney. And so it's a wide range of manifestations.
So what if you think that you might have lupus yourself? How do you go about diagnosing it?
It's a difficult diagnosis to make because of the wide range of manifestations lupus patients have, and also the wide range of severity. Some patients have mild lupus, some patients have severe lupus. So to make a diagnosis of lupus is a clinical diagnosis. You do a good history, good physical examination. And then most patients with lupus have a positive anti-nuclear antibody, or ANA. And if we see that, then we get more specific antibodies and sometimes do a biopsy. So it's the difficult diagnosis to make is a constellation of the way you make the diagnosis. And also the ANA, anti-nuclear antibody, can be present from, it's not specific for lupus, it can be present with other inflammatory conditions like rheumatoid arthritis. Patients can have a viral illness to kick off the immune system, make antibodies, and even normal patients can have positive ANA. So if your ANA is positive, anti-nuclear antibody is positive, does not mean that you have lupus. You have to have a whole constellation of symptoms, clinical manifestations to make that diagnosis. Is
there any new treatment out there for lupus right now?
There have been several medications over the past several years that have come to the forefront to help increase our armamentarium for treatment of lupus. Additionally, there's several clinical studies going on looking at more medications in the pipeline. So some news there.
And it's my understanding there's no cure.
No cure. It's a chronic illness. It can wax and wane. Some patients can develop a remission for many years. Some patients have a more unrelenting course. So it's a wide variability of that as well.
Well, Dr. Joseph Skender, thank you so much for being here this morning and kind of talking through lupus with us. I'm sure there's people that might think, do I have this, do I not? And hopefully that maybe gives them some answers and some guidance to seek treatment and get that diagnosis.
Thanks for having me.